Hello everyone. So today we are going to discuss about the subacute combined degeneration of spinal cord, also known as SCDC. So basically, what is SCDC? It refers to the degeneration of posterior and lateral column of spinal cord as a result of vitamin B12 deficiency. So it is generally seen in the patient with chronic deficiency of vitamin B12. Okay, so we know the function of vitamin B12. It keeps our nerve fibers healthy. It produces new DNA in our body, right? And if there is a chronic deficiency, it will result in a nervous system damage, usually associated with the pernicious anemia, right? Now, what is the pathology behind SCDC? There is a diffuse neuron degeneration of white matter of spinal cord. So it will affect the white matter of spinal cord. Also consists of a patchy loss of myelin in dorsal and lateral columns. So there is a degeneration of myelin sheath. Swelling of myelin sheath characterized by formation of intramyelin vacuoles. Formation of vacuoles lead to the separation of myelin from small foci of tissue destruction, right? If the myelin sheath is damaged, then it will result in a slow conduction of nerve impulse, right? Changes begins in the posterior column of lower cervical and upper thoracic spinal segments. So it primarily affects the lower cervical and upper thoracic spinal cord, but may even affect the medulla of the brain. Lesion is scattered irregularly through white matter of spinal cord. Prolonged deficiency of vitamin B12 leads to the irreversible nervous system damage, right? So in a patients of chronic vitamin B12 deficiency, there will be some sort of nervous system damage which is irreversible, right? Experts believe that lack of vitamin B12 causes abnormal fatty acids to form around cells and nerves. So myelin sheath will be replaced by the abnormal fatty acids. Accumulated methylmalonic acid believed to be cause of myelin toxicity, right? So basically it is a degeneration of the nerves. It will damage the myelin sheath. Now what are the symptoms? So basically it follows the nervous system damage symptoms. Abnormal sensation of legs, arms, trunk or other area. Tingling, pins and needles or shock like sensation, numbness, weakness of legs, arm and trunk, which progressively worsens and it is generally symmetrical. So there will be a paresthesia, which is also known as pins and needle sensation, numbness and weakness of the extremities. There will be an unsteady gait, clumsiness, stiff or awkward movements. Clinical features of SCDC: slowly progressing spastic paresthesia of hands and feet. Paresthesia means pins and needle sensation. Distal sensory loss, especially proprioception and vibration. So what is proprioception? It is a sense of joint position, right? So there will be a distal sensory loss, weakness of distal limbs. Corticospinal signs such as spasticity, hyperreflexia and Babinski signs are present. So these are signs of the upper motor neuron lesion: spasticity, hyperreflexia and Babinski sign. Positive Rombach sign, cognitive affections such as irritability, confusion, drowsiness syndrome, dementia, right? So these are all the symptoms of vitamin B12 deficiency. Visual problems: if untreated, it can lead to the ataxic paraplegia. Okay, so it will be if left untreated, it will cause a paralysis of the lower limb, also known as ataxic paraplegia, followed by the unsteady gait. Causes and risk factors: vitamin B12 deficiency is the main cause, which occurs due to the GI malabsorption, right? Vitamin B12 cannot be absorbed from the GI tract. Pernicious anemia, post gastrectomy, which will also affect the vitamin B12 absorption. Crohn's disease, celiac disease. Nutritional deficiency, then nitrous oxide in susceptible patient, B12 is inactivated. So nitrous oxide will inactivate your vitamin B12. Now how to examine the SCDC? First of all, we will perform an eye examination which may indicate damage to the optic nerve with abnormal pupil response, decreased visual acuity. So optic nerve will get damaged and it will lead to the abnormal pupil response and visual problems. Patient may have difficulty in vision. Complete blood count may show anemia. Pernicious anemia can be confirmed by positive findings on Schilling test. If folic acid was used to treat anemia, neurologic symptoms may develop even if anemia is no longer evident, and this may make diagnosis difficult. Serum levels of vitamin B12 are low. So to examine the case of SCDC, first of all we will ask the patient to go for a vitamin B12 test, right? So if there is a deficiency, then there will be a symptoms of SCDC in chronic cases. Now what are the differential diagnosis? Demyelinating disorder like multiple sclerosis, infectious disease like HIV and herpes virus, inflammatory process sarcoidosis, ischemia and neoplasm, Brown Sequard syndrome, which is a form of spinal cord damage, TAPS dorsalis, and Friedreich ataxia. Now how to make diagnosis? In SCDC, abnormal signal intensity is particularly prominent in dorsal columns. Location is suggestive of demyelinating disease. How to prevent SCDC? Some strict vegetarian diets may be low on a B12, and supplementation can prevent the disorder, right? So we have to take a diet which have a very greater amount of vitamin B12, which is present mostly in the non-vegetarian foods. Avoid nitrous oxide anesthesia in susceptible patients. Treatment: vitamin B12 injection can be given. Folic acid treatment can be start, right? Early treatment gives a good outcome. It should be treated promptly. Injection are often given once a day for a week, then weekly for about 1 month, and then monthly throughout. What is the prognosis? It depends on the chronicity of condition. Treatment in early stages gives complete recovery, right? So if we started treating deficiency of vitamin B12 as soon as possible, we can prevent this disease. If delayed for 1 or 2 months, recovery is not complete, right? And it will lead to the irreversible nervous system damage. In chronic cases, treatment may stop progression but do not recover function that is already lost, right? If the case is chronic, we can stop the progression by starting the medication of vitamin B12, but we cannot recover the lost functions, right? If untreated, it results in a progressive and irreversible damage to the nervous system. So it is essential to start the treatment as soon as possible with the vitamin B12. Now what is physiotherapy assessment? So history may suggest the insidious progressive onset. Personal history may suggest strict vegetarian diet, less milk intake, right? So if the person who is a strict vegetarian, who cannot eat non-vegetarian, may have a vitamin B12 deficiency, right? Observation: posture and gait abnormalities will be present, especially unsteady gait or ataxic gait might be present. Trophic changes are seen due to sensory problems. Higher mental function assessment: mental changes are variable from mild forgetfulness to complete dementia or psychosis. So basically these are the symptoms of vitamin B12, right? Deficiency. Severe dementia is uncommon, but in some cases it is initial symptoms. Sensory assessment, which shows the loss of position and vibration, right? Proprioception and vibration sensory changes will be present. Sensation to touch, pain and temperature may be diminished due to damage of the columns of the spinal cord. In motor assessment, there will be a weak muscle of upper limb and lower limb, which is usually symmetrical and progressive. Muscles may develop spasticity. Reflexes are often abnormal or exaggerated and a positive Babinski sign. Romberg test positive in advanced condition and unsteady gait. So these are all the symptoms of upper motor neuron lesions, right? It resembles the symptoms of upper motor neuron lesion. Balance and coordination will also be affected. Clumsiness, stiff or awkward movements will be present. Ataxic gait will be present due to sensory cause. Functional assessment, there will be a difficulty with fine motor activities due to distal affection, right? Distal motor weakness. Now physiotherapy management. How can we treat the patient of a SCDC, right? So we have to give a physiotherapy. First of all, we have to give a psychological support, by maintaining a non-threatening environment, gaining confidence of the patient and positive reinforcement, right? And education of the patient, especially the diet and nutrition education. Then we have to improve muscle strength because there will be a weakness, right? So we can perform active exercise, free weights, pulley system exercise, TheraBand exercise or manual resisted exercise. We can go for the progressive resisted exercise to improve the muscle strength. Then PNF exercise for the lower limb. Strength training in functional activities. Increase range of motion, right? Active and passive exercise of joints, stretching of muscle around the joint to maintain flexibility and provide optimal range to the joints. Okay, so then we have to reduce the spasticity by performing antispastic positioning, right? Relax passive movement, slow sustained stretching, slow icing, massage, rocking and rocking movements. We can go for the roots approach, right? Rhythmic rotations, yoga and meditation, active strengthening to the antagonist group of muscles. Improve, then we have to improve balance and coordination. We can go for the weight shifting exercise in sitting and standing, gym ball, balance board trampoline exercise, addition of manual protuberance, standing hill raise, wall squat exercise, added feedback by visual or auditory cues. Then we have to go for sensory re-education, right? Administration of different texture object. We have to give a different texture objects in a patient's hand, right? And patient have to identify. Air splints to give an additional pressure stimulation. Color grading of hot and cold objects. Care of hand to prevent from insect bites. Use of gloves in kitchen and use of proper footwear. Then we have to improve skin integrity by gently washing with a lukewarm water and use of antiseptic agent. Avoiding extreme temperature. Any pressure on skin due to splints must be avoided, and massage to increase the circulation. Then we have to go for a gait training, concentrating on heel stride length, walking on footprints, progression by chance or change of speed and direction, side stepping, backward stepping, obstacle walking and treadmill training. So it is a part of a gait training, right? So it was all about the subacute combined degeneration of spinal cord with physiotherapy assessment and management. Thank you.